The question is the bill's been now read a second time. I call the member for Fadden.
Thank you, Madam Deputy Speaker. I rise for the third time to speak on this bill and to condemn it unilaterally in the strongest possible language. This is a bill that is seeking to means test, ostensibly to put out of reach of many families, the rebate in terms of federal or of private health insurance. And the reason why I condemn it unilaterally, I condemn it absolutely, is because this is a complete and utter breach of promise and breach of faith. Prior to the 2007 election, when the current government came to power, the federal, or the then Shadow Health Minister, in a media release, now Minister Nicola Roxon, on the 26th September 2007, said Federal Labor has made it crystal clear that we are committed to retaining all the existing private health insurance rebates. In fact, I think it was 4 times, 3 times by Minister Roxon, 1 time by then Prime Minister Kevin Rudd, that the Federal Labor Party made it abundantly clear, a promise. Federal Labor has made it crystal clear, was the word the minister used, crystal clear, written in blood, so to speak, that we are committed to retaining all the existing private health insurance rebates. And here we are, for the third time now in 4 years, because this government, in an absolute and utter, complete but not unprecedented breach of faith and complete broken promise, has now decided that crystal clear actually means muddy and opaque. But it's no wonder that they're coming to break another promise to the Australian people. It was a mere few weeks when the Prime Minister said, 6 days before an election, to win an election, that there will be no carbon tax under the government I lead. The Treasurer then, Treasurer Swan, at a subsequent interview, made it perfectly clear that this overblown rhetoric of the Liberal Party that somehow Labor would introduce a carbon tax was completely false, and a few weeks later, in a move of utter duplicity, that was rolled back. So it's not unprecedented that such a promise would be broken, but how the Federal Health Minister can walk into this chamber, the House of Representatives of the nation, where 150 men and women gather from all 4 corners of our land, after she has made a comment that Federal Labor has made it crystal clear that we are committed to retaining all the existing private health insurance rebates. What she meant to say was that we're going to make it crystal clear we have absolutely and utterly no commitments to our promises. We will not retain any of the key elements and articles of faith that we say. When we say existing, we mean partial or some, or perhaps even none, and we have absolutely no concern for private health insurance of ordinary Australians. These cuts undermine the government's complete and utter botched attempts at health reform. We all remember Prime Minister Rudd putting out that wonderful colour brochure before the 2007 elections, a picture of the Prime Minister there talking about the buck stops with me on health. I'll fix health, it said. If this is not fixed within 18 months, I'll go for a referendum on taking over full control of health. Another broken promise from the government. Where's the referendum? Where's the I'll fix health? Has the buck left the building? Who is taking responsibility? Followed up, of course, with the great commitment on sorting out health, taking 30% of the GST of the states, putting in place 3 new bureaucracies. Where has all that gone? This government's attempt at health reform has been botched, has been bungled, and has been duplicitous from the very beginning. This government never had any intentions at all about fulfilling any of their promises in terms of health. I've listened to the debate this morning, and all I've heard is Labor members of Parliament rattle off a whole range of ancillary decisions that have been made in health, somehow to disguise the fact that they are committed to have a sound vision and a long-term plan for where they're going, when in reality this is simply the politics of divide, of division, of somehow some farcical class warfare that will have to take away private health insurance or the rebates from those and nationalise and socialise health in terms of one size fits all. But be under no doubt, These changes, apart from being duplicitous in the extreme, will force people to drop private health insurance cover or choose cheaper cover. It will put enormous upward pressure on insurance premiums, and it will force more people into overstretched public hospital systems. Systems where, on the Gold Coast Hospital, from where I am, 46% of people that go into emergency at the Gold Coast Hospital, 46% hit access block right now as a statement of fact, which means they will spend 8 hours waiting or on a trolley before going into a hospital bed. And it's this system, broken by Labor state administrations, that this government wants to force more Australians onto. And for what sound reason, may I ask? Because somehow those people who've taken out private health insurance are what, wealthy beyond measure, are they? Not deserving of assistance in any way, shape or form? You want to force decent, hard-working Australians who work hard, who take out private health insurance, in many ways because they have little faith in the current systems that Labor administrations have presided over, and push them onto a hospital system at a state level that is struggling. It is a blatant cost-shifting measure from the Commonwealth to the state's public system. And this income, or this measure, won't just be felt by those on supposedly higher incomes. It won't be felt by those who incur up to 43% increase in their premiums. It'll be felt by everyone who will incur those cost increases. It'll be felt by all Australians with private health insurance who face higher premiums into the future. We believe everyone should have access to affordable health care. We believe everyone should have access to choice in health care. We're strongly supported providing all Australians with that choice through affordable private health insurance if they wish to take it out. As a reduction of the introduction of the private health insurance rebates, the Medicare levy surcharge and lifetime health cover under the previous coalition government, private health insurance coverage increased from 34% in 1996 to 44% by 2007. 33% increase, a staggering increase in Australians that elected for choice. Every dollar of funding provided for the private health insurance rebate saves $2 of costs that are then paid by private health insurers, so says Econtech Proprietary Limited, Harper Associates and Hagen. Private hospitals right now treat 40% of all patients in Australia. 40%. In 2009-10, private hospitals treated 3.5 million patients. Private hospitals perform the majority of elective surgery in Australia, 64%. And 10.2 million people, or about 45%, have private health insurance. And it's interesting when you look at how private health insurance works. In preparation for this debate, I went and had discussions with the CEO of the Sisters of Charities Hospital in Brisbane and, of course, the CEO of the Uniting Care Hospital System. And it's interesting, for every 7 clinicians they have, a doctor or a nurse, 7 clinicians, there are 3 non-clinicians, administrative staff. And then we have Queensland Health, for 18 years presided over by the Labor government. Queensland Health has 64,000 employees. Why? Because the enterprise bargaining with the union, the first line says you cannot reduce below 64,000. The union's not interested in reform or productivity. It's interested in union jobs. But for every 3 clinicians, there are 7 non-clinicians. So private hospitals, private health, doing the bulk of elective surgery, treating 40% of all patients. Private hospitals, the ones I've spoken to in Queensland, 7 clinicians for 3 non-clinicians. The public system, 3 clinicians for every 7 non-clinicians. It doesn't take a rocket scientist to work out what the problem is in our public health system presided over by Labor administrations. The waste is beyond measure. And this government wants to force more and more people into that untenable, poorly managed system. The impact will be significant. 2.5 million people will be directly impacted by these changes and will face immediate increases in premiums of 14%, 29% and 43% in the respective income tiers. 2.4 million people will be impacted. And it's not as if the cost of living increases aren't already striking Australian families. Electricity, since this government came to power, has increased by 51%. Gas prices over 20%, food by over 20%, rents in the same type of quantums. Wherever this government has gone, so too has the cost of living. And now this government wants to do it to 2.4 million Australians and put enormous pressure on the existing public hospital system because, in their class struggle view, these Australians are wealthy and don't deserve assistance from the Commonwealth. The government-owned insurer Medibank Private has predicted, the government's own insurer has predicted, that 37,000 of their members alone will drop their cover and 92,500 will downgrade. This is considerably more than the 27,000 the minister has claimed, so I'm not too sure where the minister's getting her advice from. Perhaps from her press sec. We know how well Labor press secs are doing as late. Deloitte analysis of the changes showed that in the first year, 175,000 people would be expected to withdraw from private hospital cover and a further 583,000 downgrade. Over 5 years, it's expected that 1.6 million will drop cover and 4.3 million will downgrade. Now, the government hasn't disclosed the numbers of people expected to downgrade, but as premiums increase significantly for those in the income tiers, it's reasonable to expect they will seek cheaper products, which will have a whole range of second-round effects on public hospitals. Deloitte continues to predict that private health insurance premiums will rise 10% above what they would otherwise be in the initial phases. There will be $3.8 billion in additional recurrent costs for the public sector. And where will the public sector get that from? Look at Queensland, my home state. The Labor government there over 18 years, the credit rating of the government has been downgraded. Why? Because their public debt on their balance sheet is now $40 billion, with a further $43 billion on the balance sheets of the government-owned entities. The last 18 years, the Labor government has gone from a zero debt position to $87 billion in net debt at a state government level. A level of debt that is almost unable to be paid back when you look at the structure of the government's fiscal position. Indeed, Defence, including Veteran Affairs, spends as much money in terms of budget allocation as the government in Queensland does, to give you an idea of where they're going. But then again, we shouldn't wonder at that, considering the fiscal position 4 years ago of the Commonwealth in terms of public net debt was zero, with $60 billion in the future fund and $40 billion either in the bank or in the surplus. And now, in a staggering turnaround, we're at $133 billion in net debt. A staggering turnaround in public finances. These changes will have a huge impact across the nation. But more importantly, the changes are symptomatic of the Labor government's view of where things are going. This is just one more in the tragic litany of broken promises. And I remind all Australians what this government said prior to the 2007 election. What they said publicly, what they put in writing in their media releases, what the Prime Minister-to-be and the Health Minister-to-be said. They couldn't have been clearer, just as the Prime Minister couldn't have been clearer when she said there'll be no carbon tax under a government I lead, and 3 weeks later she broke it. Prior to that election, the Prime Minister-to-be and Minister for Health-to-be said federal Labor has made it crystal clear that we are committed to retaining all the existing private health insurance rebates. They had no intention of keeping that, Mr. Speaker. They had no intention of keeping that at all. And every government member on that side of the House that sits there like the lobotomised member for McEwen and argues against it, simply agrees with the government on that point. I withdraw, Mr. Speaker. The government knew it then. It knows it now. At some stage, the duplicity has to stop. At some stage, this government has got to actually start keeping their word. Wouldn't that be a novel approach for the government to have? The Coalition will vote against this en masse and will strenuously reject it here and in the Senate.